I chose a study comparing squatting and lying down positions during labor. I picked this study because birth position is very relevant to midwifery, but I also liked that the statistics they used were ones that we covered in class. So the researchers wanted to know whether something as simple as changing a person's position during birth could actually affect measurable maternal and newborn outcomes. Um, so my first slide is, does birthing position matter? And then here is the link to the study down at the bottom. And this trial was conducted at a hospital in India. It was a prospective randomized control trial. What were they asking? The researchers didn't explicitly write out a hypothesis or a null hypothesis in the format we've used in this class, so I kind of just created them based on their research question. Their research question was, does squatting during the second stage of labor result in different maternal and newborn outcomes compared with lying down? So my research hypothesis would be that using a squatting position during birth results in different and potentially better maternal outcomes compared with lying down. The null hypothesis would be that birth position makes no statistically significant difference in outcomes, and that distinction becomes important when we get to the p-values because they used a p-value below 0.05 as their cutoff for statistical significance. The purpose of the study was to compare outcomes and assess the risks and benefits of squatting during the second and third stages of labor. Who was studied? This was a hospital-based prospective randomized control study conducted over 18 months. There were 212 participants total, with 106 in the squatting position group and 106 in the lying down group. The participants were greater than 37 but less than 41 weeks, had singleton pregnancies with a vertex presentation, and were considered low risk. The researchers excluded several higher risk situations, including fetal distress, severe hypertension, severe anemia, malpresentation, and suspected large babies. And I think that's important when we're interpreting the results because these findings really only apply to a fairly specific low risk population rather than every person who's giving birth. I also thought it was interesting to note that these moms, some of them were first-time moms and some of them were like second or third-time moms. It didn't really specify that in the study, but I do think that that is something that we should consider when evaluating these results, because oftentimes we see that moms who have previously given birth before do have shorter labors, and that's not always the case. I think that it varies from pregnancy to pregnancy, but it is something that I've noticed in my own practice as a doula and a student midwife. So I like to keep that in mind while interpreting these results. The sampling method, this part confused me a little bit at first because the study is randomized, but that doesn't mean it was a random sampling. The women came from one hospital only and were enrolled if they qualified. So I would consider that convenience sampling. And once they were in the study, then they were randomly assigned to the two groups. So I think that was a good design, but studying only one hospital does limit how much we can kind of generalize the results for everyone. And then here is what they found. And this is where it gets more interesting. The second stage averaged about 25 minutes in the squatting position group compared with 35 and a half minutes in the lying down group. So about a 10-minute difference. The third stage was also shorter, about 12 minutes for squatting versus 22 minutes for lying down. And oxytocin was needed by about 40% of the squatting group compared to almost 55% of the lying down group. Not everything favored the squatting group, though. Average blood loss was actually slightly higher in the squatting group, about 336 milliliters compared with 324 milliliters in the lying down group. So they would consider that difference statistically significant. And something that I thought was very interesting was the episiotomy rates. They were somewhat lower in the squatting group, but the p-value was greater than 0.05, so that means that the difference was not statistically significant. And I was actually shocked to see the high number of episiotomies in general performed in both groups. I think that 54% for a squatting group is insane, and 60% for a lying down group, to me, sounds like that is just general practice at this hospital in India. I know, at least here in America, episiotomy rates are not that high, at least at the hospitals I have worked at in Georgia. And then some information about the babies. I wanted to include the newborn outcomes because shorter labor does not automatically mean a better outcome for the baby. Birth weight was essentially the same. The 1-minute APGAR was statistically lower in the squatting group, which I thought was interesting. Although the 5-minute APGARs, there was no statistical significance. Difference. The fetal distress was also not significantly different between the two groups. And this is a good example of something that we've talked about in statistics in this class, is that the statistical significance doesn't automatically mean clinical significance. So a statistical difference in the 1-minute APGAR doesn't necessarily mean that there was an important lasting difference in the newborn outcomes, especially when the 5-minute APGAR scores were considered and they were not significantly different. So why did they use these statistical tests? They used different tests depending on the type of data. So for things that were measured with numbers, like minutes of labor or blood loss, they compared the averages using a t-test. And then for things that fell into categories, like whether someone needed oxytocin or had an episiotomy, they used the chi-square test. And I agree with those choices because the tests fit the type of data that they were comparing. And then did they reject the null? For some outcomes, yes. Did they prove their hypothesis, or I guess the hypothesis that I came up with? I wouldn't simply say yes. For several outcomes, the p-value was below 0.05, so we can reject the null hypothesis for those individual outcomes. Birth position was associated with differences in labor duration, oxytocin use, pain scores, and blood loss. But there were other outcomes where the p-value was above 0.05, so we failed to reject the null hypothesis for those. I think saying it that way is more accurate than saying the study proved squatting is better, because the evidence suggests that position matters for some outcomes, but not for all of the outcomes. The study also found significantly lower pain scores during several stages with squatting, although 4th stage pain did not differ much. Would this change my practice? Overall, I think this was a useful study, but I wouldn't take it to mean that every person should give birth in a squatting position. So I think that I would use this information in my practice, but with some perspective. The sample came from one hospital and included a low-risk population, so I would be cautious about generalizing it too broadly. There were also outcomes that didn't favor squatting, including the slightly higher blood loss and more episiotomy extensions. So the results aren't completely one-sided. What it would change or reinforce in my practice is the importance of not treating lying down as the automatic position for birth. If a low-risk client wants to move, squat, kneel, stand, or whatever position feels right to them, I think that evidence like this gives me another reason to support that choice when it's appropriate. And typically in home birth, we support what the birthing person wants to do. We never really force any position on them. So my biggest takeaway isn't that squatting is the correct birthing position. I think that something as simple as maternal position can affect measurable outcomes, and the position that's most convenient for the provider isn't always the position that's best for the person giving birth. So I do like to keep that in mind, and I think that's a good comparison to make for like hospital births versus home births. And then here is the reference. Thank you so much.